Good afternoon, everyone. We are just waiting a couple more minutes more just to start the learning community session. We're just giving people some additional time to sign on. So if you can just hold on for a few minutes, we'll start very shortly. Thank you. Okay, let's get started. So good afternoon, everyone, and welcome to the Gender Responsive Services for Women Learning Community. We're so glad you could join us this afternoon for our fourth session, which as you can see, is focused on achieving successful outcomes with women involved in court processes. So I think you all know from earlier sessions that this learning community was created just exactly for Justice and Mental Health Collaboration Program grantees, or JMHCP grantees, as we say for short. So we're so glad that you all have been participating throughout the learning community. Our office, the Council of State Governments Justice Center, is hosting this learning community. We're the training and technical assistance providers for JMHCP grantees, and this learning community is funded through the Department of Justice Bureau of Justice Assistance. So we're very grateful for that support as well. We're also excited to continue to hold this learning community in collaboration with Becki Ney, who oversees the National Resource Center on Justice Involved Women. Okay, next slide, please. Great, so this next slide just gives a sort of snapshot of the agenda for today. We're going to start off with some introductions, and then I'll be turning it over to Becki Ney, who will kick us off with an overview of courts and a gender responsive approach, and then we're going to spend a good amount of the time today with our guest facilitators hearing more about their work. We have the team from Vera County, Texas joining us, and so we're really going to spend a lot of time today hearing much more about their work, their experience on the ground. They have their key partners and collaborators here as well as the court team members. And so we're going to also have some time for interactive discussion and questions at the end before we have a wrap up at the end of the learning community session. Next slide. So to start off with, we want to just do some quick introductions on our end. We have a lot of facilitators today, so I think Rachel, I'll just ask you to start us off with a brief introduction.
Sure. Hi, everyone. Glad to be joining you today. I'm a policy analyst in the Behavioral Health Division here at the Council of State Governments Justice Center. So I work with Allison, and I believe I work with some of you as your TA coach. So nice to see some familiar faces. Becki?
Hi. Hi, everyone. I think I've had the opportunity to be with you on each of the webinars, those of you who have joined. I'm the director of the National Resource Center on Justice Involved Women, and pleased to be partnering with CSG on this effort.
Great,
Allison.
thanks so much, Becki. So, and I'm Allison. Sorry, Becki, were you finished? Okay, I think so. So I'm Allison Upton. I'm helping to facilitate the webinar today. I work in the Behavioral Health Division. I'm a project manager here at the Council of State Governments Justice Center, filling in for Felicia. So some of you also know one of our other TA coaches on parental leave. So if we can go to the next slide, we have a great contingent here today from Bexar County. So we'd also love for you to do some quick introductions. So we can just go down the line here. Nicole, I think we can start off with you. That would be great.
Hi everyone, my name is Nicole Bermejo. I'm a licensed professional counselor here in Bexar County for the local mental health authority called the Center for Healthcare Services. I'm the behavioral health supervisor who oversees the case managers assisting here at the center.
Hi, yes, my name is Annie Cortez. I am an LTC and clinic administrator with our local mental health authority here in Bexar County, and I oversee our specialty court programs.
Hi, I'm Victoria Spicer. I'm an LPC supervisor. I am the owner and clinical director of Rosetta's Key Therapeutic Solutions, and I've been working with the specialty courts since 2006.
And good afternoon. My name is Ernie Glenn. I am the judge of the Bexar County Felony Specialty Courts. We have multiple parts to our program, but the Women's Mental Health Court is one of our big parts at this particular time. And actually, we've been building that up for quite a few years. I'm one of the original founders of our felony drug court program in Bexar County. We started this in 2003, took our first clients in 2004, and we have since added multiple tracks to our program to be able to handle various different populations.
Hi, I'm Kathy Johnston. I'm the case manager with the felony drug court. I will explain my position a little bit later.
Hi everyone, my name is Diana Zamarron. I am the drug court manager for the felony specialty courts in Bexar County.
Great, thank you so much. I just again want to welcome and thank all of our presenters and guest presenters today. Thank you for taking the time to join into this session. So as far as expectations for the learning community, I probably don't need to say too much at this point because we're on session 4. And so I know you all have been actively participating, but just a reminder, we've been lucky to make this learning community pretty interactive and discussional. So we just encourage you, if you feel comfortable, to use the video function on your Zoom platform so that we can have more of a discussional feel to things if you feel comfortable. We also have a lot of content that we're covering today. So we're hoping also, and we're imagining that there could be a lot of questions, and we're going to try to get to as many of them as possible. We're going to have a discussion portion, but if you think of questions and you'd like to chat them in as well, please feel free to do so using the chat box. And also, I guess this particular time, I will just, for this session, encourage you, if you can, to include your name or your jurisdiction along with your questions, just so that, again, we're going to try to cover as many questions as we can, but in case there are some that we can't get to in the time period, what we can do is send the questions on to facilitators and make sure we know who to get responses back to in the end. So that would be really helpful if you could do that today in particular. And also, we usually have some recommended resources or activities in between sessions, and if you haven't had the chance to do so already, I just encourage you to take a look at the SAMHSA document that we sent out on the essential components of trauma-informed judicial practice. It's a really great resource. I'll be sending it out again to everyone after the session, along with the slides from this session and the recording once we get it posted and ready. And maybe since this is our 4th and final session, actually, maybe what I'll do is just send all the resources together again, so everyone has them in one group. And but we'll definitely include the slides and recording from this session as well. Okay, next slide. All right, so what we'd like to do is, of course, get some introductions on your end. We'd like to do our usual roll call to see which teams are in attendance today. And again, if you have multiple people on your team, we just ask in the interest of time that you select one spokesperson who can share the names and of your team members that are on today, and also their roles or their titles, so that we have a sense of who's in the session today. And so we'll just go team by team, and usually we start off alphabetically with Dare County, but we know they're all they're in full force here today. So we'll skip next to Bureau County. I think that Bureau County may not be able to attend today, but just in case, I will ask if Bureau County, anyone from Bureau County, Illinois, is on the line, is in the session today. Bureau County. Okay, well, we'll check back again possibly later, but I thought it might be possible they would not be able to attend today. So next we'll ask if anyone from Marion County is in the session today. Anyone from Marion County, if you're able, if you're here, please unmute yourself and we'd love to hear your introduction. Okay, I thought that Marion County was going to be attending, so I'll probably come back to them. In the meantime, we'll go to Newcastle County in Delaware.
Hi, this is
Hello.
Hi, this is Officer Kearns, Newcastle County Police. We are in a co-responder model to handle 911 crisis calls and follow up to other calls that patrol goes out on. So we have a social worker, Alex Schofield, and Officer Marlon George also on the call.
Oh, great. Thank you so much for taking the time to join today. We really appreciate it. Okay, and next up, I think we have some people from New York State Unified Court System from the Buffalo team. Is anyone from that team on the line today?
Hi, it's Alicia Tavliago from Buffalo Human Trafficking Intervention Court. I'm the resource coordinator with the court. And our grant is trauma initiative that we are looking to use. We work with a clinical team in Buffalo, Evergreen Health, and we have an evaluator via evaluations. And our hope is to provide a trauma response in the court setting with our human trafficking victim defendants that we encounter.
Great, thank you so much, Alicia. I think today's session hopefully will be particularly interesting to you all since you're a fellow court team. So thank you for joining.
Thank you.
And next up, yes, next up, is there anyone again also from New York State Unified Court System? Anyone from the Rochester team that's here today? Anyone from Rochester? Okay, we'll come back and see. It's a little bit tough because we also switched our session time, so we appreciate that that those of you who are able to join did join. Okay, so next up we have Palm Beach County Sheriff's Office. I know there are folks on the line from there. If someone's talking, can you make sure to unmute yourself?
I will say hi for everybody. I am Cassandra Ackenplunk. I'm one of the research partners for the Palm Beach County Sheriff's Office, along with my colleague, Dr. Vaughn Critchlow, and then we have Danielle Ovalette and Jenna Rollins, and I'm not sure if Lieutenant Randy Foley is on the line, but we are implementing a school and community violence prevention task force within our community. And so I'll leave it at that.
Great, thank you so much, Cassandra. Appreciate it. Yeah, I hope people can hear okay, as I see that they're on the line. So if anyone's having any tech issues, please also try to chat that into us, and we'll do our best to try to help resolve it. Okay, I'm glad you could make it, Palm Beach County. And next up is Richmond Behavioral Health Authority. Do we have anyone on the call today from Richmond?
Hi, this is Lauren Stevens. I'm from RBHA. I'm one of the research assistants in our grant department. And I think Brittany Cox, also in our grant department, is with us today. We have a circuit court behavioral health docket that this grant is helping to support. So we're looking forward to beefing up some of our interventions and our numbers based on what we've been learning.
Great, thanks so much for joining us. And next up, I think, and I'm seeing a message from South Carolina. Thank you, Dr. Soto. I'll mention that when we get to you. First, we're going to get to Sonoma County. Is Allison Lobb? I think I saw Allison on the line.
I'm here.
Yeah.
Hi.
Hi.
I'm here, Allison Lobb. We have the Mental Health Collaboration Project, and I'm the program coordinator for that. And I know that Zoe Jones is on the line. I saw her name in the list of participants.
Yes.
She's our,
yeah, I think she's here as well.
Yeah, she's our great case manager. She's with Interfaith Shelter Network, which is our CVO partner on this work, doing an incredible job providing transitional housing in a pretrial program during COVID and emergency bail of $0. So challenging times, and IFSN is really rising to meet the challenges, and we're very happy to be partnering with them and very happy to have Zoe as the person taking care of our people who are getting out.
Yes, definitely glad to have her on the project, and thank you so much to both of you for joining. And I also have a message. Next up is South Carolina Department of Corrections, and Dr. Brittany Soto is in attendance. She's having some problems with the microphone on her computer, so she wanted to make sure that we all knew she was here. So thank you for making it today, Dr. Soto, and we're glad you can at least hear us, and maybe you can chat in any questions that you have later on as well. And I'm also getting a message also from Andrea from Rochester Human Trafficking Intervention Court, New York State Court. So Rochester team is also here today, and she was working with a client. So this is the work that has to be done, right? So she's on phone and she's working to get a better connection. So welcome also to Andrea. Okay, so we'll go on to, and I know some other folks from Palm Beach County are having some issues too. So we'll work on that as well. And so I'll look also now to Village of Orland Park. Is anyone from Orland Park in the session today?
Hi, can you hear me?
Yes, we can hear you.
Okay, wonderful. My name's Jennifer O'Hare. My colleague Amy is also here with us today, and we're working with the Orland Park Police Department. Our main goal is to get mental health treatment to those that need it, so that they're not, ending up in, jails or hospitals. We want to be able to give them the needed help.
Great, thank you so much. We're so glad you both could join. Yeah. And we'll go next to Warren County, which is Bowling Green in Kentucky. Is anyone in the session today from Warren County Sheriff's Office?
Yes, this is Mitch Miller. I'm one of the research partners, along with my colleague, Dr. Ben Stickle, who is also on the call. I don't believe anyone from the Sheriff's Office is on today, but our emphasis is on enhancing connections to treatment for duly diagnosed offenders, especially with focus on establishing a research practitioner partnership with a local provider, as the Sheriff's Office currently is in a very challenging situation of having to effect 2 and 2.5 hour one-way transports to the local treatment providers. So we have an uphill challenge ahead of us, and we're looking forward to coming up with solutions.
Wow, that is a big challenge, and we appreciate both of you being in the session, taking the time to be in the session today. Thank you so much. So that's probably others have similar challenges, and I wonder if we'll hear anyone speak of that today. And then as far as our attendees, last but certainly not least, Yolo County. Is Yolo County, I believe people are on the line for this team?
Hi, this is Preston Schraub with the Yolo County DA's office. I'm joined by Joseph Goki, Deputy Public Defender, and Jasmine Gonzalez, Deputy Probation Officer. We are a collaborative mental health court. We partner with the courts, probation, public defender's office, DA, and Health and Human Services to identify people, both men and women, with mental health needs. We also have an addiction intervention court that we work in as well. Our programs are designed to mitigate the consequences of the criminal justice system, sometimes diverting individuals completely, sometimes just diverting them away from the prison system as an alternative to sentencing.
Great, thank you so much. And we're really glad that you're also, as a fellow court team, we're really glad that you're able to join today as well. Thank you so much to everyone. Okay, I think we can move on to the next slide. So we have a lot of content to cover, so I'm going to get right to it and hand it over to Becki Ney. Becki?
Hi, thanks. We could go to the next slide. Great. So I just wanted to do a couple minutes of thinking about what we've covered, this being the fourth session, but over 4 sessions. And just as Allison said, she'll catalog things and get them all out to you. It's gone really quickly for me, these 4 sessions. I don't know about the rest of you, but we hope that we've been able to share information and experiences across the grantees to increase sort of knowledge of folks that you can take into your grant programs about what we know about the evidence for women. We have exposed you not a lot, but to some of national experts and folks who are working with these issues day to day. And we hope it's added some value to your work. So I hope it won't be our last time to talk. You certainly know how to get in touch with Allison and her colleagues, and you should take full advantage of them going forward, even though this learning community may be finished. Next slide. Just very quickly, I want to get to the Bexar County folks and don't want to spend very much of your time today, but just as a quick recap, we spent the first session, you may recall, just laying out some of the facts we know about women, sharing some strategies. You have a resource guide that we provided that is really excerpted from several other documents on some key issues. Next slide. We then talked about women's rule-breaking behaviors. And again, our focus has been to be most responsive to all of you at each decision point and how you think about holding women accountable in the criminal justice system at various points, and what that suggests about how you may respond. We provided a discipline guide that we created for women's facilities, but many of most of the sections and certainly the appendix, which is the research, is very pertinent, I think, to all of you. Next. In our last session, you'll recall we had Detective Bo Gucky from Seattle talk with us, and we gave you a link to a TED Talk. She certainly had a very different perspective about working her work with women from a police perspective. And lastly, let's go to the next slide. Today, we're going to spend some time talking about courts as another decision point. Obviously, we haven't been able to really delve deeply into the myriad of issues that we might like to. We hope we've encouraged you to know enough about each other that you could reach out, not just to CSG, but to each other as you have questions or want to learn from folks, or think about, I'd like to include this in my program. I wonder if that grantee in Palm Beach or South Carolina or New York has done something like that, and just reach out. You have contact information and can continue to do that. I'm just going to share a couple of things, a few thoughts with you about courts, and then turn it over to Bexar County. So let's go to the next slide. I think it goes without saying, I think we've reiterated this at virtually every one of the sessions that we've had, that incorporating a gender responsive and trauma informed approach when working with women, regardless of where they may be in the criminal justice system, can lead to more successful outcomes. And certainly there is a ton of research now that supports that. From a court perspective, especially, I think understanding the impact that trauma may have, and I know many of you are and have talked about how you're incorporating trauma-informed approaches in court processes, those of you who are working at that part of the system. And perhaps today we can talk about whether that kind of understanding has led to more successful interactions and outcomes with the women that you work with. I think it can assist in fully engaging women. I know we are all being very sensitive to avoid re-traumatizing women wherever they may be in the criminal justice system, and ultimately to help them heal and recover, which leads to reduced recidivism. Next slide. Just a couple of strategies. Just always remembering that women's behaviors may be reflective of survival skills that they have developed to deal with abuse. Some of those behaviors may not look very appropriate, but have served them well since they are still standing on their own 2 feet and still able to maneuver in their lives. I think it requires a real shift in how we think about and act on women's behaviors and crimes, considering what really brought them into criminal justice and how they got there, who they may have been with, what the circumstances are surrounding those crimes are important to understand. I think training and building staff skills, whether it be motivational interviewing or around trauma-informed principles or building skills around communication and interaction, whatever it may be, I would like you to think about what kind of training have we done for our court staff or any of the staff on the grantees represented here, and what does that suggest about, you know, the rest of our agency? I think Detective Bogacki, when she said, you know, we have some people who are trained here that are working with women very effectively, but what does that suggest about the rest of the police department or the rest of the courts? So we might come into a specialty court working with women, but what does that suggest about when they have to go into anybody else's courtroom? So consider how you might bring some of your knowledge and expertise to other parts of the court system. And I would encourage you, if you haven't already, I know you are having regular team discussions in the courts represented here in a collaborative way about the women that come before the courts and what's going on in their lives, whether they are complying or not complying or doing well or not, and how you can continue to support them. But I wonder if you've had any intentional conversations about how to enhance what you're doing to be more gender responsive and trauma informed. So I encourage you to do that as well. Let's go to the next one. Obviously these things all, I don't think I have to repeat them, but at a minimum, figuring out how to have dignity and respect for all peoples, not just the women, but for each other. Use every interaction is an opportunity for engagement, obviously. And we've talked about women's relationships over the past couple of sessions in terms of building rapport and trust and how important that is for women. Take every opportunity to positively affirm and build on her strengths. She may come to you with a serious relapse or be in non-compliance, but I'm sure there would be some good things going on that you could start with and suggest that, you know, thanks for coming in on time, thanks for showing up. We have some hard things to talk about today. Let's talk about what's going on in your life that's good, and then we'll get to the stuff we really need to deal with. So think about your approach and how you do that, and always communicate, obviously, in a trauma-informed way. Next. And I want to talk just lastly for the next slide and just briefly here, how can you create an environment that promotes healing, safety, and meaningful interactions? So think about, what does our court environment look like? What does the environment in which we bring the women in? How easy is it to get into the court building? I imagine there is security that everybody needs to go through. Have your security officers been trained in trauma-informed approaches? What kind of shape is she in by the time she gets to your courtroom? Her having to come through security, maybe having to be patted down, walking through crowded and noisy hallways, although in the age of COVID, presumably none of that's happening anymore. But you know what I'm talking about. So consider strategies as you look around, not just your courtroom, but around the entire court building and all the processes that women have to engage in, that you can continue to support and expand the work that you're doing. So lastly, next slide. Think about the seating. I have not been to any of your courtrooms, but believe me, I have sat in literally hundreds of courtrooms around the country. The judge is always higher up and on a bench. Does the judge come out from behind the bench? Is there an opportunity to build some greater rapport and trust? Can she sit closer to the judge? Do you just have her stand up at a Diaz or at a public defender or a prosecutor's table? Are there intimate and, well, not intimate, but are there personal kinds of things, issues going on in her life that she may be embarrassed by, that you may want to pull her up closer and talk to her about? What does the signage in the courtroom look like? Is it all like negative? Don't do this, don't do that, don't stand here, don't have a cell phone, don't speak loudly? And are there ways to have signage that may be stated in different language, more positive language, that's less intimidating and threatening? What's the noise level like? I mean, courtrooms, courthouses typically are pretty noisy places. People are often upset, not in their best place because of where they are. But most courtrooms, conversely, are often quieter. But what's the noise level? And are there things you can do about that? What about the lighting? Sometimes the lighting is fairly harsh. It's bright. It may be daunting. I don't know if you can do much about some of these physical things. Consider how you're communicating. Are there ways that you can communicate in more gender responsive and trauma-informed ways with a softer voice without yelling and screaming? And again, I don't suggest that those things are going on in your courtroom, but certainly they have gone on in various courtrooms that I have sat in over my past number of years. And then, very thinking outside the box, very untypical. I have been to a lot of specialty courts. There are always tears. Always tears for joy or for sadness, and graduations, there are tears. Do you have tissues in the courtroom? Depending on the time of day, think about providing any kind of candy or fruit. Think about pillows, those benches. I've never sat in a courtroom that wasn't hard as a rock and hard as wood, and maybe that helps. So any of the ways that you can build rapport with women, make them feel more comfortable with you, are wonderful opportunities. And lastly, just again, think about ways that you can expand the work that you're doing to be more trauma informed and gender responsive throughout all of your court processes. So with that, I'm going to turn it over to Deanna at Bexar County for the more interesting part of today. Look forward to hearing from Bexar County. Deanna?
Thank you. Yes, the Bexar County Women's Mental Health Court is one of the specialty courts we run here in Bexar County. It was created to address the opiate epidemic in the San Antonio community. This specific project was started in the fall of 2018, but we've been working with this population for many years. The Felony Specialty Court is the largest therapeutic court in Bexar County, possibly in the entire state of Texas. Like the judge mentioned earlier, we run several tracks. Those include the Felony DWI Court, the Felony Co-occurring Disorder Court, and the Felony Reentry Court. This specific court serves 40 women with co-occurring disorders. Can we move on to the next slide, please? Here are the eligibility standards for this court. We target high risk and high need individuals that are on felony supervision. These individuals must be willing to comply with substance abuse treatment and mental health services. One of the major differences between a regular district court and a therapeutic court like ours is that we tend to ask, what happened to you versus what's wrong with you? By addressing the trauma, we have a greater opportunity to help the individual and reduce recidivism. Next slide, please. Here's our screening process. We get referrals from our 10 criminal district courts in Bexar County. San Antonio is the 7th largest city in the nation, so getting referrals is not a problem. We aim to have referrals screened for services and enrolled in counseling within 14 days of receiving the referral. The screening process includes a risk need assessment, a mental health screening, a TCU drug screening, and an adverse childhood experience screening. Next slide, please. Individuals are then set for court to observe the court proceedings and see for themselves the difference between a district court and a specialty court. Our court proceedings include a lot of smiling faces, a bright open courtroom, a friendly judge that doesn't wear a robe unless it's a special occasion. He only puts that on when it's time to have someone's probation terminated, and that's usually when the family is invited to come into court. So unlike a regular district court, when you see a judge in black, that's a scary thing. Here, it's a great thing. Our clients know something's about to go down. That means usually somebody's probation term is over. He also puts that on when it's time to phase an individual to the next phase of the program. So we also use a lot of incentives. This is an overall very safe setting. We're located right next to the reentry center, so there's a lot of services available to clients. Earlier you mentioned about not having the judge sit at the bench. Our judge has not been doing that for years. He comes to the client. And so they're on the same level. So that's something that you don't typically see in other courts. Our referrals also meet with the Drug Court Alumni Association mentors. These individuals have completed the drug court and they volunteer their time to come into court to help ease anxiety for the newbies. Because anytime you go to court, you're gonna have anxiety. You're not sure what's gonna happen. And these individuals are very special to our program. The fact that they volunteer and they come in, bring snacks, they just hold a very important role for us. They go into a separate conference room. They talk to the newbies about what their experience was like while they were in drug court. They answer any questions that they may have. Next slide, please. If the referral chooses to enroll in the specialty court, at that time they're assigned a drug court officer, a case manager, and a treatment provider. At this time, I'll go ahead and pass it over to Kathy Johnston, our women's mental health case manager.
Hi, I'm Kathy, and they call me CJ for short, sometimes AKA Mom. My duties begin once they're accepted into the program, when they are assigned their probation officer and case manager. I set up the appointments for them and get things going. On that first contact with them in the office, a full needs assessment is conducted with them. And that includes addressing their housing situation, which a lot of them come in homeless. So that's a very important role that we have different options. If the family is not appropriate, we look for outside sources like an Oxford home, which is known as a sober living home, or we have what we call Haven for Hope, where our homeless society is taken in, provided shelter, meals, and training for job skills, have medical and things available to them. If they're in need of inpatient treatment, we will set up places that are local, that some of them are specialized just for women and children. Some of them are just for the women, and we'll get them set up for that. And if need be, a little bit more structured, they will go inpatient. And so we'll have to get that all set up for them. We also help them with their ID recovery, because the majority of them come in, they have lost their IDs, lost their social security, their card, their birth certificate. So we will take the steps that's needed to regain all that information. We'll also help them with transportation, either by providing bus cards for them, or we've actually implemented a new little program. It's called the Bike Rentals program here, where we have had bikes donated. And we have one of our other case managers that has the skills and ability to fix up broken ones to make them quite usable. So we have that ability to have them sign a contract, and they can take it to their sober home or their home and use it as long as they need. We also will get them set up with medical, either see if they qualify for Medicaid, or there's other programs like Texas Healthy Women programs we could get them set up with, or it's called CareLink. So we'll get them set up with that. And when time comes, we will help them with their employment status. We have access to many staffing agencies, and we will connect the clients with those. Or if we hear of positions open from other clients, we will connect them through that way. And also there's quite a few that come in with very little education, or some of them even college that want to continue. So we will set them up for either the GED programs or connect them to the local colleges around so they can continue that education. We also address their nutritional needs. Some of them come in with health concerns and stuff that they need to eat better and stuff. So we will set them up, or we'll even go online on good old Google and do some research for foods that would help them in their situation and stuff. We also have a food cart here that we will keep stocked and supply the clients with that. We also have a clothing closet here, and because a lot of the clients come in that are, in dire straits of needing clothing. So if we don't have it here, we will set them up with resources that can meet that need. We also have the ability to send out a mental health referral for them, and we use the Center for Healthcare Service, which you will hear from next. They will be referred to that agency, and the agency will conduct intake, and then they'll go see a provider in which they'll be diagnosed, and if need be, they will be put on MAT, which is medicated assisted treatment to help with their addiction. We also see the clients weekly, sometimes more than weekly, in our office to deal with just getting them situated with, like I said, with the needs or just support or other things. And we have a weekly team staffing, which we go to with the rest of our team members. And that's when we report on the status of each of the clients. And also, if they're having a good week, we will suggest a good praise, verbal praise, or some other kind of incentive. And if they're having a week that's not so good, they're struggling with many issues, they're coming up dirty on their UAs, then we will suggest some sanctions, which could include just a verbal admonishment or essays or community service. We could suggest GPS monitors. There's just a lot of different things that we kind of bring up to the team, and then the judge will make the final decision. Then we also go to court weekly with them, and we will stand up. Well, when we're in person in court, we will actually go up with them to the bench for added support. And then, if need be, more information will be provided. If something was reported incorrectly in staffing, we will correct it if we got that information, or if something comes up that needs to be addressed that wasn't in staffing, we can address it there also. Another duty that we have is drug testing. They do go to a drug testing lab, but a lot of times they don't have the money to go to the lab. So we will have them come over here to our facility, and we will test them here. And sometimes we'll just pull random on them here. If we have any inclination that something's going on or anything going on, we will collect that UA. We will provide those results on what we call a UA log, and that log is sent out daily to the rest of the team members, so everybody is on the same level of knowledge on how the client's doing. We also have another ability of collecting UAs on them with the sweat patch, and we're all certified into that area of applying those sweat patches, and taught quite a few of our clients that try to be sneaky. So it's a good tool that we can use. So the case manager is a good in-between person between the judge and the treatment providers. because a lot of times the clients get a little hesitant at first about sharing different things, but they kind of tend to loosen up with case managers because it's not like a, I don't know, court session, treatment session. It's a little bit more homey, but that information is taken down as the office visit is being conducted and passed on to the other team members. So everybody is still on the same page, which really helps for the client to have a full circle of treatment. So we can go to the next slide, and that will take us into Miss Victoria.
Hi, so after we get the referral from the court, from one of the case managers, we schedule the client at a time that is going to allow us to take the time that we need to with the client. So we try to make sure that we have 2 to 3 hours to spend if necessary to do that intake with the client. Once they get here, we establish that individual treatment plan and what we consider for the women as which MRT, if at that time they need to be placed in MRT. One of the things that we ask is, what is the client wanting to work on now? So their treatment plan is going to be focused on their needs at the time that we get them. Of course, in treatment, we can adjust their treatment plan at any time throughout their treatment episode. The other thing we ask and look at is, where is the client mentally and physically? Do they have the mental capacity and stability to do the work that is required for MRT? And there's a lot of homework in the main MRT. Well, actually in both MRTs, there's a lot of homework that they need to do. So they have to have the mental capacity and they need to be stable mentally to be able to do that work. We don't want to increase trauma with the homework that we provide them. We also look at their physical location. Are they in a place that they are able to actually do the homework? You know, if they're living in work release, it may not be the best time to enroll them in MRT because they're not able to do the homework. And under the main MRT program, there is, for lack of a better word, there's a sanction, a consequence for not coming to group with your work ready. So we don't want to do that. The other thing that we look at, are there any physical or disabilities that the client may have that may prohibit them from doing the MRT work or may become a problem for them? So for example, if we have somebody with a low reading or writing or score, we may not want to put them in MRT because of the amount of writing and drawing that is required in that program. So we look at those things. The other thing on the MRT modality, How to Escape Your Prison, is the main MRT book, which teaches moral reasoning. It has a freedom ladder, which focuses on clients' behavior and thought processes. And some of the assignments have a pass or fail component to them. So when you're assigning a client to that, you do not want to put a client that has a high anxiety level and is in fear constantly in a program that has a pass or fail, because you're already setting them up for increased levels of anxiety. So we don't want to do that. In the trauma MRT, Breaking the Chains of Trauma, we teach it teaches what trauma is. It helps the participants understand trauma. It does not go into individualized trauma. So the clients do not, with the exception of 2 exercises, they do not discuss their own individual traumas. So that's really important, and the clients are told that from the beginning, that that is not what will happen in that particular MRT group, that traumas are discussed in individuals. It opens the door for trauma discussion. That's what the trauma MRT book is about. It helps the clients become more comfortable in understanding what trauma is and why trauma occurs. And the main thing about that is that they understand that they're not alone in their trauma. In a lot of cases, clients feel like what happened to them is, number one, it was their fault, and number two, it's never happened to anybody else. And by doing it in the trauma MRT, it helps them to understand that those 2 things are not necessarily true. Other areas of focus is their self-esteem. So what we do here is we try to take every opportunity that we can to help build a client's self-esteem and self-worth. A lot of times when clients come here, they're coming straight from jail. So a lot of them are still, in the past, were in work release. They would come in, they'd have very little clothing, very little hygiene products. So we provide those to the clients here as well. Also, when they come in, we do have a lot of conveniences here. So there's food kept here for them, food and drink. There's activities for them to do while they're waiting for a session. So for example, if they have nowhere to go, so they can come here earlier. They don't have to come right at their group time. There's a place for them to hang out and do things and talk to their other participants. So one of the things to help build self-esteem, an example here is that we allow clients to dye their hair here. So we have 2 bathrooms that have full showers. So the clients are able to do that. We discourage any wild colors, surprisingly. So we ask them to keep it to something that would be appropriate. We use a strong cognitive-based treatment here. So a lot of times what we're focusing on is what is the behavior and what is the outcome the clients want. And we challenge them to make sure their behavior and their thought processes are getting them to the outcome that they are desiring. So we created a sober home about a year ago. The reason we did that is because we found that there was not enough safe places in our community for our clients to go to upon release from various systems. And even some cases, maybe they do have family, but living with family is not conducive to their recovery. So we created the RK House, which is right now, we only have the women's home. In the future, we'll be opening some other homes. We're hoping to open a women with children's home as well as some men's homes. So in the RK home, they are completely client run. Staff does oversee, but there is no staff living there. So the clients are responsible for all the activities that occur in the home, from cleaning to cooking their meals, even the grocery shopping. So with COVID, we went to having the groceries delivered. Now that things have lightened up a little bit, the clients go to the grocery store and they do their actual own grocery shopping, which we pay for, but they have to do the grocery shopping. Let me see. One of the things that makes us different than, next slide, please. One of the things that makes us different from the other agencies, I think, is our level of communication with the clients. We have a group chat, which was started prior to COVID. And since we now have COVID and we're in semi-lockdown status, it helps us a lot in communicating with the client. So the group chat was originally created so that we as staff could communicate with all of the clients at one time instead of sending messages one by one. But we are able to post information on office events that are going on for the clients, group schedules, and we are also able to provide words of encouragement. So any of the staff can go on there at any time of the day and post an encouraging note to the clients to let them know we are still thinking about them and to help them continue to stay on the right track. It also allows for the clients to be able to chat with their other group members and send words of encouragement and ask questions about things as well. So the group chat is wonderful. I encourage any agency to do that for your clients. You'll find it makes your life a little bit easier with certain things. We also have sober events. Well, one of the things that is incorporated into a client's treatment plan is a requirement for them to participate in our social events. Now the social events we have are designed to treat coping skills, social skills, which our clients are lacking in a lot of cases, and allows family to participate in their group sessions, but not in such a formal way all of the time. And a lot of times family feels left out. They don't know what's going on. They don't know the counselors. And this helps them to get to meet us in a more relaxed atmosphere. So let me say, one of the things about our events is we try to keep all of our events and activities as inexpensive as possible. We get a lot of donations from other agencies to help with various costs of things, and we help clients obtain things like for our annual Dream Party, which is a formal, semi-formal event that includes a meal, it includes door prizes, there's a DJ, and the clients are required to dress up, and that creates lots of anxiety for them in getting preparing for that. And so we do have to do a lot of encouragement, but once they get to the party and see what's really going on, they enjoy it. Now, one of the things about that is that it helps clients understand that they can go to a party without drinking, without using drugs, without fighting. They can have family there and enjoy themselves. So that is one of the best things about the party. It's a lot of work, but it turns out great afterwards. We have done hiking events, which the clients love as well. And our past one that we did right before COVID started, we had a probation officer who we went out with, and I'm not for sure how many miles we hiked, but we went out early in the morning and did a hike. And then we also, family was permitted to come with that. And then after the hike, we went to a recovery cafe. So there is an agency here in San Antonio that has a restaurant, and it's purely donations, but it's for recovery. So we went there to support them, and then we got to have a meal after the hike. We have an arcade garden, which the clients love. Unfortunately, the homeless around here love it too. So they like to come in and help themselves, not only to whatever's been produced, but they have helped themselves too. We did a stones. We painted stones and put words of affirmation on the stones, and they had them in the garden. And one day the clients came and they found them under the bridge on the way to the office. So the homeless came and took the stones along with the vegetables that they got too. So we also do home economics and baking. So a lot of people, well, what does that have to do with treatment? Well, if I don't know how to cook a healthy meal, or if I don't know how to cook at all, then, you know, and I'm trying to live on my own, then what problems does that produce? So we do the home economics, we do the baking, and that also with COVID, that also helps with boredom, and it also helps teach them coping skills. So we do full meal preparations. I've taught them, those that are diabetic, how do you cook a diabetic-free, you know, a meal meant for somebody that's diabetic. We also in the past have had where the clients come in, we actually have meals ready for them that all the clients partake in. When I'm gonna have a lot of energy, I will go in and cook for everybody. I did this because a lot of times when clients come, they're coming from locations where they haven't eaten all day. And I find that allowing them to come and eat and get fed, they're more productive, they're more relaxed, they have less anxiety when it gets time for them to get into their actual treatment sessions. So we do that. Our arts and craft, which is called expressive therapy, ranges from anywhere from sewing to right now we are engaged in painting. So I started them out with I started them out with just drawing with a pen, and then we went to watercolors, which is very simple and easy to buy. It's $1 for a watercolor kit. And then we are now in acrylic painting, which is $5 for a set at Walmart. So I show them how to do various things based off of financial restrictions as well. Next slide. The other thing is our counselors, we attend all of the weekly team, staff, court meetings and reviews, and we keep frequent communication with the team. So the judge, the case managers, the probation officers, we're all in contact, and not just 8 to 5. A lot of times we're in contact, 8, 12 o'clock at night, we're still working on cases and dealing with situations. And so I will turn it over now to Annie with the Center for Healthcare Services.
Hi, thanks so much. So as mentioned earlier, I work with the Center for Healthcare Services, and we have actually been in continuous operation since 1966. We are actually one of 39 local mental health authorities that provides mental health services to those individuals with severe mental illness, intellectual and developmental disabilities, as well as substance use disorders and challenges. Our organization is actually the third largest LMHA by population in the state of Texas. And we place an emphasis on safety net services for the insured and underinsured populations here in Bexar County. So our consumers do not require insurance or funding to receive services. Our sponsoring agencies are, of course, Bexar County, as well as University Health Systems within the Bexar County Hospital District. Next slide, please. And so some of our major collaborators, excuse me, to name but a few, are listed here on this slide, some of which are the Southwest Texas Regional Advisory Council, University Health System, Haven for Hope, as well as the San Antonio Police and Sheriff's Department. So we work collaboratively with these entities to assist with ensuring that we're able to meet the needs of those individuals whom we serve. So at this time, I'm going to go ahead and pass it on to our behavioral health supervisor. She is who helps to oversee the direct services that our team actually provides.
All right. My name is Nicole. As Annie introduced, CJ was actually talking a lot about my stuff earlier, so she gave me a really great introduction. I am kind of the direct line of communication from the drug court team at the county to the Center for Healthcare Services, the local mental health authority that works with them. I get referrals for intake and get those consumers and clients connected with a clinical case manager here with the center. They are the ones who provide the services to the consumers in the felony drug court program. And our mission is to help meet the consumers' clinical and community resource needs to successfully reintegrate them back into the community and prevent future arrests. Next slide. And like I was saying earlier, each consumer is assigned a case manager who they see either weekly or bi-weekly, also depending on the phase that they're working in with the felony drug court program. Some of them are in a later stage of their program. They've been doing it for a while, kind of seeing them once a month. So next slide. One of the things that we do here with the center as the clinical side, we also offer medication compliance. They have access to treatment with a advanced psychiatric nurse who prescribes their medications. The case managers, the clinical case managers here at the center are able to oversee what medications they're taking, make sure they're linked with appropriate coverage for their medications. We assist with paying for their medications if they don't have insurance or can't afford them at the time. We also use evidence-based curriculum to help educate them on the importance of medication compliance, the benefits in managing some of the symptoms of their diagnoses, as well as understanding the medication that they're taking and how it can benefit them. Next slide. We also do attend the weekly follow-up. So as some of the felony drug court team was mentioning earlier, they have multiple staffings and engagements with the consumers. The case managers here attend those staffings and provide reports depending on the phase of the consumer, if they're in compliance with their treatment. And this is beneficial for the consumer by allowing the case manager to provide that extra support and continue to advocate for them during their treatment. And they assist with any treatment follow-ups requested by the court. Sometimes if Judge Glenn says this person needs to see the doctor, we say get them in to see the doctor. Next slide. And we also, as Kathy or CJ was describing earlier, we also assist with referrals in the community. We assist with supported housing services, transportation services, prescription assistance programs to help cover medication, as well as supported employment services through the Center for Healthcare Services. Next slide. We also wanted to share a couple of success stories. We have 3 felony drug court case managers with the Center for Healthcare. One of them is Thomas Lopez. He described a consumer who entered the program with a history of substance relapse, which got her in trouble with the law, and a loss of her home and her employment in the months that she's been working with felony drug court and their amazing team. She remained sober and is following through with steps to regaining her life. Next slide. All right. Second success story, we have Vanessa Chambers. She shared a consumer who, due to her traumatic history with substance use, lost custody of her youngest son and was able to get support and therapeutic alliance with, the Felony Drug Court team, and was actually able to regain custody of her son with their support and help. So it's wonderful. Next slide. And I believe this is the last success story for CHCS that we have. Paul Salinas worked with a consumer who graduated from Felony Drug Court and Center for Healthcare Services that had gone on to become a certified recovery peer coach, and is also a member of the alumni group that helps with the mentors through the Felony Drug Court program. So I know that they see that a lot within their clients, kind of continuing that cycle to go back to where they started to help others and promote that support as well. But I think that's all for me. And now I'm gonna turn it over to Judge Glenn to kind of give you guys a summary of the Bexar County court system.
Okay, I think we're ready for the next slide here. Oh, we got it. Okay. So we're going to put up some numbers here so you can see who actually is in our program. And I know when I first looked at the numbers, I was looking at these percentages and thinking there's a lot of overlap here. And yes, there is going to be a lot of overlap. I was actually a little bit surprised with the anxiety numbers. I thought it was going to be higher because it seems like more of our people have anxiety than what these figures actually show. So I think it's relatively accurate based upon the information that we can get, but I would actually nudge that up just a little bit. And, it was mentioned earlier that when I do court reviews, I don't do this from the bench. I stand up in front of the group. They're usually sitting in the benches and they stand up when we speak to each other. And I do that because that long walk from the benches all the way up to the front where the judge normally sits carries a lot of anxiety with it. And that was one of the things that we noticed early on. Maybe we can reduce that. And to me, the best way to do that was, I don't get anxiety standing in front of people and talking because I've been doing that for 40 years now as an attorney. So it's no big deal for me. So I can actually approach them and handle that, and it works out a whole lot better. But anyway, you can see our numbers for depression, anxiety, post-traumatic stress disorder, bipolar disorder. That's not to say that there aren't other things that we're dealing with too. Because obviously we're going to have some schizophrenia that we're dealing with some folks, and schizoaffective disorder. But these are the major numbers that you're going to see with the folks that we have in our program right now. So let's see our next slide. And let's see, we say our minimum term of the program is 18 months. It's pretty rare for somebody to finish 18 months. Our experience is it takes close to 2 years, or about 2 years on average, for someone to really make all those changes and get into the good habits that they need to have to carry this on afterward. Because let's face it, folks, any of us who deal with mental illness, we know that you're going to go through this over and over again with the same client. That, well, I stopped using my medications because I was feeling really good, and I didn't think I needed it anymore. And of course, within the next 2 weeks, they're decompensating and falling apart and having all kinds of problems. So go through that a few times, and we're able to get them to finally, hopefully understand that this is something you got to carry on for the long term. So those sorts of things, those sorts of changes do take a long time. And with the average age of our people at 34, I think that probably fits in with what most people would see out there. We started doing an ACE score for our intake quite a number of years ago. We wanted to add that in along with our mental health screening, our substance use disorder screenings, just to kind of give us a better idea of who we're dealing with and what sorts of issues they were bringing to us. So I know we've been doing that for at least 10 years, if not longer, but somewhere around 10 years I'm going to report. And I think it's been a lot of help, because that was when we decided that we were going to start becoming a trauma-informed system and build that up as time went by. And listening to everybody talk today, when I'm hearing Deanna, CJ, and you know, Victoria, Nicole, Annie, everybody speaking, I think you can see that we really have wrapped this up into the way we do business here, because we know that we're going to be more successful if we can deal with our folks with their mental illnesses, their trauma, substance use disorders. It's not mom and dad's drug court that I started out in back in the early 2000s. This is something that's developed over the years to actually deal with issues that we've seen over the years, but didn't always have the resources to deal with. But luckily we do now. And you can see that when we're doing our ACE, that we find that about over half of the ladies have experienced some sort of sexual abuse, and that's on the ACE. That's not even including the things that happened to them after they reached what's considered adulthood. So we know that there were things that carried on after that too, and maybe part of that is what you can see. If we can see the next slide, please. What you can see, I believe that's, well, yeah, where a lot of the ladies have prostitution charges. So we know there's sexual trafficking going on here too. These are things that carry on, and we like to know about all these issues so we can consider those too, because I'm a firm believer that, sure, the things that happen to you before you're 18 years old are going to affect the way that you develop, the way that you act, the way that you do things. But I know that traumatic events happen to you after you're 18, and they hurt and they create issues that you need to deal with too. So those are things that we always want to keep in mind. You saw on the prior slide that, you know, a huge percentage of our ladies have had contact with Child Protective Services, and to me that's another source of trauma sometimes. At least the Child Protective Services our ladies were dealing with for a lot of years before they kind of started changing the way they do business, because I think they've gotten a little bit better over the years, but most of the ladies have had some pretty bad experiences, and they come to us really afraid of Child Protective Services. They think anytime that they're in the picture that they're going to lose no matter what. And it takes a lot of reassuring to show them that that's not the case, and let them know that if they'll stick with us and do what we ask them to do, that we'll stick with them too. And one of the ways we do that is when Child Protective Services is involved in one of our cases or becomes involved, is we have them become basically part of our team. We have meetings with them too. And we want to be on the same page. We want to know what their goal is. We want to tell them what our goal is and try to make these things blend together a lot better. And of course, we don't want to overlap services either. So we want to make sure we all work together a little bit better. And I think that's been much better for our folks. I know they feel better about it. And I think it also helps them be more successful. And quite frankly, it makes Child Protective Services feel better about what's going on too, because they know they're under our care and they understand how it's going to go. So, you know, looking at the rest of the slide here, every time I go to an NADCP training, and God, I've been to those for, I don't know how, since way back 2004, I guess. I don't know. It's been for quite some time. And once they started talking about using medication-assisted treatment, I was a little shocked in a way, because I just thought it was natural that you would know that people are going to need medication-assisted treatment at times, and that shouldn't affect whether or not they can be involved in a program. I recall judges running programs before in the early 2000s that if someone was on methadone, they were not allowed in the drug court program. They had to get off that first. And somehow they just never seemed to make sense to me, because you break your leg, you need a cast and a crutch, and once it gets better, you can walk again. So why not give them the opportunity? So we've never had a problem with that. So we have some ladies who are, of course, on methadone. We use naltrexone. We have buprenorphine. You know, whatever seems to work for a particular person or is available for that person, depending upon the things that we actually do have available. And I think everybody's done a pretty good job of laying things out up to this point. So are we to the point where we're ready to start seeing if anyone has questions? Oh, that's our drug court.
Sure. Yes, thank you, Judge Glenn. And I know you all have this great photo too as well. I don't know, Deanna, I'm not sure if you want to say something about this, because I know it's got personal meaning to the court team, but.
Yes, this was created by one of our participants, probably from 2008 or so. She suffered with major depressive disorder. She was an IV heroin user. She was in the drug court for a few years, got her life back on track. And to this day, we keep in touch. Now she is a student at Our Lady of the Lake University. She's raising 2 children. She's a licensed chemical dependency counselor. And she puts events up over at the San Antonio College to raise awareness on mental health issues, on substance abuse. And in her eyes, we are her superheroes because she got her life back. And she's an inspiration to us. She's a fantastic lady. And I love that she cut about 20 pounds at least on this picture. So I love her even more.
Allison, I wanted to make one other point or make something clear, because
sure.
And looking at the slides, I was 100% of our folks, because of the way this grant is, I suppose, have had addiction with opiates. I don't want anybody to go away from this thinking that that's all that's involved, because there's a lot of multi-substance use here too. And we find quite a lot of our folks use the opiates, but they also use methamphetamine, and sometimes they use marijuana, other drugs too, of course, and every now and then we see cocaine. The big ones here are methamphetamine and heroin. And well, it seems like everybody smokes marijuana at some point, and alcohol. So I want to throw that out there too, that there's a lot of polysubstance abuse. It's not just opiates. So don't go away from this think that that's what that slide means.
No, thanks for clarifying that. That's great. I know they have to at least have that. That was one of the qualifications. But yeah, very good point. And I'm guessing the courts and the other, obviously, all teams in the session today probably are facing the same challenges. So thank you for clarifying that. So we want to use the time we have left for questions, for discussion. Just a reminder, you can take your microphone, you can unmute yourself. If you'd like to ask any questions now, also feel free to, I know some people are having some tech difficulties with the mic, so feel free to chat in your questions and we can get started. I don't know if anyone has any questions to start with.
I guess I would like to know, both from any of the other grantees who are working with courts, human trafficking courts, mental health courts, what are some of the things that you heard from Bexar County today that are similar or different, challenging? I mean, did you take away some things from Bexar County that you think, I might try that, or we already do that? But I guess I'd like to hear from some of the other court folks about their response to today and what their courts may look like.
Hi, it's Alicia Tavliago from the research coordinator from the Human Trafficking Intervention Court. I thought that was a great presentation. I was really interested because of the ability to be able to connect with the women in the court. But I was wondering, because we run into this ourselves from time to time, if you notice a breakdown in trust when you have to random talks women in the court, if that's an issue. Can you hear me okay?
I don't know if, okay. I guess I'll try to answer that question then. I don't see that as being a real issue, because yes, we're going to test them in the court and maybe randomly, but we try to make it clear to them that we just really want this information mostly to know where they are in their recovery and what we need to do to deal with it. If they use, why did they use? I mean, we use it more therapeutically, I think, most of the time than otherwise. And I believe that the way that we do it, our clients tend to walk away even more trusting than they might have otherwise. I don't know. What, Victoria, do you think it might be?
Okay, that's good to know, because
No, Judge, I believe you're correct. I think because when clients first start the program, we let them know at any time they can be required to submit a random UA. And either at treatment or at the court, when they go see their case manager. So they know randoms are part of the program. And we also tell them that randoms are not necessarily to catch them, but it is to catch them. Meaning we're their safety net. We do not want them to fall. And if we're not checking on them, then what will happen is that they'll fall and they'll get back deeper into their addiction. And that's what we're trying to prevent. So we let them know that when they start.
Yes.
That's good to know. Yeah, I figured you'd have to because of the basis of the court with most women having substance use issues. I was just wondering because I know with our court, most of the charges in our court are very low level, so we don't have to, we run into an issue where we can't really do much with our cases as far as sanctions. We don't want to do sanctions like that anyway, but I know with your level court, with felony level, I know you have to do those things. I wasn't sure if that was causing an issue with, sort of confusion with the women in your court.
Well, the way we do it, I don't think so. And because when they first come into our program, we understand that they're addicted to substances. We understand they've got mental health issues, that they need stabilization. And we're not going to give them big sanctions, or actually at first we're not going to give them any sanctions when they're using, because they're not just, we know they're not just going to stop. So we kind of use this as a training tool too, because I know it's something that they're not used to. They can do a UA, they can be positive, and we're going to talk to them about it, find out why are you using, what is it we can do to help you not. We need to learn some coping tools here and show them that it's okay to be honest about it, because that's, that's one of the primary concerns with any of our programs is people need to be honest in order to make the real progress that they need to make. So I think we can use this as a teaching tool too, that you can use, you can talk about it, be honest about it, and you're not going to be thrown in jail. And they're used to the exact opposite. They're used to going to the district courts and regular probation or whatever it is, and being thrown into jail because they violated the conditions of bond or the conditions of probation.
Right. That makes sense. Thank you so much for answering that.
Sure.
Sure. What about maybe the, team members from Richmond or from Yolo County? Are you all in your courts? Are you, after what you heard today from Bexar County, are you hearing things that are similarities, new ideas that you'd like to try? Preston, are you still with us from Yolo County? Just curious if you're able to answer, or if any of the team members from Richmond today. Preston, are you unmuted? Can you hear me? Or
yeah, I can hear you. I was about to jump in when there was a pause. Yeah, I mean, we have a similar, it's tough because you never know exactly what is causing the issue. And so you have to attack it from multiple fronts, right? It's the mental health side, it's the medically assisted treatment side, and there's no like perfect combination. It has to be tailored to that individual. So I heard a lot of things that your program's doing that's mirroring what we do in our county. You definitely are taking, for instance, because of the way your grant is written, the opiate focus, like we just started recently doing that in our jails for heroin, opiates, and alcohol. So that's something I think that we can embrace more and really try to integrate that into the system. But once we, our participants usually aren't in custody for too long. They're usually placed in one of our local placements relatively quickly, within a couple weeks. So once that happens, the medically assisted treatment tends to fall off or not really be necessary anymore. So I think it's really more of an early prevention. Like we need to catch these people when they first get into the system, the first in our county jail, identify who these people are, and then get them on that track. I think that would make a big difference in our county specifically.
Great, thanks so much. And I'm curious too about Richmond, if Brittany is able to respond, or maybe Lauren Stevens, but if you have to unmute yourself. I'm not sure if they're able to unmute. Maybe having some trouble unmuting yourself. Oh, did I hear someone?
It also looks like there's a question from someone else. I don't know if you see it.
Oh, yes, maybe Zoe, would you like to jump in?
Hi, I would. I have a question. I work on a little bit of a different side than it sounds like most people here. I'm a case manager for a transitional house for mentally ill pretrial offenders. So they're people that haven't been sentenced yet. And right now, there are no women in the house. We're actually working primarily with men, but we do have a house that is dedicated to women that are offenders, that are on probation. And this is kind of a funny question because it sounds, I don't know, like I guess I should already know this, and we do in some sense, but we all really struggle. There was this bit about honesty and being honest that was being brought into the conversation. And I am wondering if anybody has any really good tips or tricks for getting people to be honest with you, because it's something that me and all my coworkers struggle with. We, especially with the women, they are not very upfront, and I don't really know the best way to go about it. I try, and I don't get the best results. So I don't know if anybody can share any information around that.
Well, one of the things that I would like to say is it's going to depend upon the circumstances, what's going on with the client. So what I find sometimes is that when client, for example, if they've relapsed and we're asking them about the relapse and they're denying the relapse, sometimes when you take that pressure off of them. So I'll ask them, okay, well, if you did use, what's the worst that's going to happen to you? Or this is potentially what can happen. And when you take that pressure off of them, it gives them that opening to go ahead and tell you what's going on. In other cases, I will not say anything more about it if they're adamant about not using. But what I have found is that when we do our introductions for group, a lot of times they will come out at that point in time and they will tell me their real sobriety date. So, and it's not challenged at that time. I just let it go. I don't say anything about it, but I have learned not to get into battles with clients about whether or not they're telling the truth. So they will be honest when they're comfortable enough to be honest. And sometimes we don't understand the reason they're not being honest with us. So we have to step back and take a look at the bigger picture. What's more important, their honesty at that moment or keeping them engaged in the program?
Mm-hmm. Yeah, that's a good question to ask.
Well, very well said, Victoria. I agree absolutely with you.
And I just want to, if you don't mind, because I'm the probation partner of Zoe, and I'm curious, Zoe, if you think that there's room for a better partnership with probation on that to maybe let people know what efficacious might be or not.
I mean, the biggest issue that I run into is that the men and women that I have worked with get so terrified of being truthful because of probation, because of the consequences that they think they are going to face. And normally I try to just tell them, if you're honest with me and I'm able to advocate for you and potentially with you on that phone call, it could go a longer way versus you lying and being found out on a drug test or something. So that sometimes works, but sometimes it doesn't. And I'm trying to get more creative about how we have those honest conversations with people, because there are some people that just straight up and down deny, and because we have not been able to drug test people since March. So it's been really tricky.
Well, then we can take this offline, but I think there's room for us to have some discussion about how we can partner better with you on that.
I would agree. But thank you for your feedback. I appreciate it.
Yeah, and this is Allison again. I think, this could be a whole nother session. So first of all, you're giving us great material for our next learning community focus, but I'm noticing the time, and I just do want to say that I think, not getting through not getting into the battle when you can is great. And also sometimes it just, even with all that, it takes time to build trust. And we know that's one of the most important aspects to working with women, is taking the time to build that relationship and build that trust. No matter what the setting, court, law enforcement, probation, et cetera, that's just part of the expected process. So you can expect, sometimes not as a rule, but often that it could take longer to build that trust with women, given all that people have been through as far as trauma in their history, et cetera. So I'm noticing the time, and I feel like conflicted. I wish we could continue the discussions on, but we're at the hour, and I just really want to thank, number one, all of our presenters and guest facilitators for today. Thank you so much to the Bexar County team and to Becki for all your work on this learning community. And also, just as importantly, thank you to all the teams who've joined in this learning community throughout the whole summer. It's really been fantastic. And we hope to offer similar services in the future, but I will be following up with everyone. If we can advance the slides, we have contact information at the end for everyone. And I will be sending out slides to the group from today's session, also our recording of today's session and all the resources that we've had over the course of the learning community. And some of the interaction today is making me feel like perhaps we could offer to the learning community also, if people would like to stay on a listserv, we'd be happy to, to continue discussions and to offer more resources as we move forward. So I just want to thank everyone, and we'll stop at this point, but wishing you all a great day, and thank you for all your participation. Take care, everyone.
Thank you.
Thank you so much. Take care.
Bye, thank you.